People don't think about asking themselves questions before they eat, like, am I hungry? Am I stressed out? People don't take time for self-care. They're just caught up in their to-do list. Helping a person take time to, self-reflect and figure out what is out of alignment in their life in terms of their overall balance has profound effects in terms of preventing disease and helping them have a greater quality of life. So the whole mindful eating aspect that I learned in the Mind Body Medicine training is really powerful in helping reduce overeating, helping lower cholesterol too. So the whole relationship between increasing cortisol, increasing hyperinsulinemia, increasing inflammation, that whole schematic that happens based on in our physiological makeup, that it has such a huge impact by just addressing how do I lower my cortisol level? How do I lower a person's stress level through mind-body medicine? It could be yoga, it could be meditation, it could be visualization, it could be deep breathing, it could be biofeedback, it could, so all these different modalities that we have within mind-body medicine. A person can lower their cortisol level, which will then lower their blood glucose level, which will then reduce their risk for diabetes, which will then lower their cholesterol, which will reduce risk for heart disease, which will then lower their blood pressure, which will reduce risk, for having to go on hypertensive medications. So it's a whole positive domino effect. The ramifications are so positive by just incorporating other modalities that people don't know about. The doctors aren't taught, first of all, like in medical school, that they get, the doctors that I've worked with, they say that they got like 30 minutes of nutrition education, and they don't get education on yoga, meditation, acupuncture, different integrative, alternative, the CAM, the complementary alternative medicine. They don't get that education generally in most medical schools. So it's not something that's being taught, and then it's not being taught in schools. I work with kids too who are overweight, and they just are fed greasy food, fried foods, and some of them don't even have the PE anymore because of the budget cuts. So they're not getting in schools. The parents don't know, and the parents hardly have time to make a cooked meal, let alone educate themselves on CAM, on complementary alternative medicine. So bottom line, a lack of education in our system, in our schools, the physicians. So where would they get it? Where would they get this information?